Hi everyone, my name is Christy Pennebaker and this presentation will be on cultural competence. Cultural competence is defined as treating every patient with equal respect and dignity, regardless of culture, ethnicity, race, or social status. According to Mesler, who did a study on baccalaureate nursing students and their cultural competence, ethnic minority groups do not have equal access and often do not receive equal care once they access the health system, whether it's because of a language barrier or lack of culture knowledge from healthcare providers. According to Ahn, who also did a study on cultural competence in the healthcare system, to deliver effective medical services, healthcare professionals need to be prepared. How can we prepare healthcare professionals? Within this presentation, we will discuss that. The goal of culturally competent care is to create a healthcare system and workforce that are capable of delivering the highest quality care to every patient regardless of race, religion, ethnicity, culture, or language proficiency. Culturally competent care optimizes patient satisfaction and better patient outcomes. I chose to discuss cultural competence because I feel it is important to have a working knowledge of the important customs, values, and health beliefs of various cultural groups to provide quality care to patients and their families. The foundation of a research study is the research question. The PICO question for this presentation will be P, which is the population, healthcare professionals, and patients. I, the intervention, will be education on cultural practices. C is the comparison, no education on cultural practices. O, the outcome, improve patient satisfaction. So the research question will be, to improve patient satisfaction, would it be more effective to educate healthcare professionals about cultural practices than providing no education? To begin the literature search, the databases I started with the Pennsylvania College of Health Sciences Library and then all EBSCO databases. The key terms I used were cultural competence, healthcare cultural competence, and cultural competence in nursing. My first results yielded 5,100 articles. I then filtered by using the peer-reviewed articles in full text only. This yielded 2,818 articles. I then used the filter to view less than 5 years, which then yielded 1,404 articles. This still was a very high number to sort through. From here, I browsed through the titles and decided what would be most applicable to my search. I then found the 5 primary research studies that I would use for this presentation. Although my search yielded very many results, within the 5 studies that I found, they vary in terms of the types of patients that were studied, patient perspectives, healthcare worker perspectives. I wanted a variety in order to gain an overall perspective on cultural competence. In hindsight, next time I would use more key terms in order to narrow down my search results. Some similarities in studies that were found is that self-reporting tools and questionnaires were used in all studies except for Kim and Lee. A limitation to using self-reporting is that bias could exist. Transcultural self-advocacy tools were used in both Kim and Lee and Mesler. The self-advocacy tool measures the nurse's confidence and awareness of cultural competence. Kim and Lee also used the client-nurse trust scale as well as the nursing satisfaction scale. The convenience method was used for both Ahn, Kim and Lee, and Mesler. Purposeful selection was used for Weech Maldonado and Hooper et al. Control and intervention groups were used in all studies except for Mesler and Ahn. And all of the conclusions of the studies support the research question. All studies concluded that cultural competence training programs and healthcare professionals being more aware and confident of cultural competence made increased and improved patient satisfaction. Differences in studies. Mesler conducted a study on baccalaureate nursing students from the beginning of their freshman year to up until graduation. The study was performed to determine if incorporating cultural competence in the curriculum was beneficial. Weech Maldonado et al. Studied cultural competence not only at a workforce level, but at an organizational level as well. Hooper et al. Examined patient perspectives on provider cultural competence. It was found that the lack of provider cultural competence directly correlates with patient non-adherence. It was found that using the literature synthesis table to organize information from multiple studies was highly beneficial. Although the 5 studies varied slightly, the overall result is that being culturally competent in healthcare benefits the patient population. Practice management recommendation. It is recommended to incorporate cultural competence within nursing curriculums. The study by Mesler suggests that we can improve the cultural competence of future nurses by changing the curriculum in which they learn. At the beginning of the freshman year, when nursing students were assessed, students from non-majority ethnic groups had significantly higher cultural competence, but not confidence. As the study went on and the students progressed through schooling, both competence and confidence increased. It can be argued that gaining experience possibly contributed to this. It is also recommended to assess cultural competence in the workplace. If training is necessary, then management should implement training courses. The study conducted by Kim and Lee resulted in that training courses were found to be effective in improving the transcultural self-efficacy of public health nurses, as well as improving client-nurse trust and patient satisfaction. If training courses are implemented, it is important to follow up with participants and patients to ensure that training was successful. A potential issue could be employee pushback, and where some employees may not see the need to participate in training courses in order to become more culturally competent, which it is important to educate these employees on why cultural competence is important in the workplace. Conclusion and takeaway. In reference to the initial PICO question, to improve patient satisfaction, would it be more effective to educate healthcare professionals about cultural practices than providing no education? Evidence shows that cultural competence education improves patient satisfaction. In order to move forward with a practice change, a review of literature and literature synthesis must be conducted in order to support the intent. From here, practice recommendations can be facilitated. As the United States becomes more culturally diverse, increasing cultural competence among healthcare workers is important to benefit patient satisfaction and patient outcomes. Thank you for listening to this presentation.